start. I guess one of the big things that is on a lot of people's minds is just what is your response to the lawmakers who are looking to strip away some of your executive powers?
I, I've heard a lot about that, but I have been so busy. It is not. Uh, I've been getting a few questions about it, but we're getting the vaccine out, building Idaho's future, what we're doing on education. I was asked about it. Of course, it's a process. The bills will be introduced. They'll have hearings on them. It'll go across the aisle. Until that point in time, matter of fact, we just rearranged my whole schedule today to just focus like a laser on getting people vaccinated.
Okay.
What we need to do with our federal partners to get more vaccine coming in, with the health districts, with the hospitals, that's because our ability for the economy to rebound, for kids to be back in school is going to be predicated on getting people protected, and that's really what I'm focusing on.
Okay, perfect. Let's talk about that then. How are you all planning to move forward? What's your next step when it comes to the vaccine rollout?
Well, of course, it changes. The feds changed the rule yesterday. I was on a call with the vice president, and Secretary Azar talked about it, but they'd already told us that we had some responsibility. And so, one of the big issues was widening the band from 75 to 65. I'd talked about it with my healthcare team, public health team, and then the Vaccination Advisory Committee made a recommendation. And then, was it yesterday, Marissa?
Your announcement?
Yeah,
Yes,
yeah. One day runs into the other. But we made the announcement yesterday about widening that. Now, what we're really focusing on is increasing capacity, that all the healthcare providers and the health districts have everything they need to get the vaccine out just as fast as possible.
So you talked a lot about during your State of the State address the other day about your budget, and education, of course, is a top priority to you. What are
You were paying attention. I'm impressed.
What are you going to do to ensure that extra 16, I think it's 16% roughly, over the next year? What are you going to do to ensure that goes into local schools rather than just, I know there was issues in the past with funding at the state level.
Well, some of that 16% was federal money that went into testing, to PPE, to whatever they needed to do in the schools. But we've basically, compared to all the other agencies, we've made education whole, and then we're fulfilling our commitment, which is our long-term plan to raise the funding for teachers, the career ladder, by $250 million. And we're going to implement the next step of that. They had a education committee meeting yesterday. They talked a little bit about how we pay for students, whether it's classroom units or whether it's enrollment, which is good. That's a discussion that the legislature needs to have. The state board, we had to make the determination at the state level because so many of these kids are in and out of school, and we didn't want to have them spend all their time counting, and so we made a little adjustment there. But this money is going to go to the bottom line. And then one of my big issues is these kids that have fallen behind. We've always got a certain segment of our population that, just because of whatever their situation is, are having a hard time catching up with kids being out of school. It's just gotten a lot worse. I mean, really, that gap between the kids that are doing well. I was on a call with one of my grandsons that is going part in person and part online, and he's doing fine. We're blessed that that's the situation, but not all these kids have that opportunity. And if these kids get too far behind, particularly if they're not reading by the end of the third grade, we know we just have perpetual problems. And, I try and convince people that, your kids and your grandkids may be doing great, but those kids that are behind just drag down the whole class for their entire academic career. And so we're going to spend a lot of resources and work with the districts and the educators about what can we do to get these kids caught back up.
So specifically on those literacy issues, what have you kind of heard about the best ways schools have found to kind of help address that with this additional money?
You know, I am so impressed with with what educators in the classroom are doing. You know, our ability to remote deliver education has made logarithmic huge improvements in the last year. That's one of the reasons we're trying to add more internet capacity all over the state and within the schools. Some of that catch-up work can be done with technology, but you can never replace the value of that comforting professional educator to diagnose the exact problem that a child has and say, here's what we need to do from a literacy standpoint to get you reading and to where you really understand what you're reading. We were making great progress on that before. We finally got the individual reading initiative, which is we finally got everybody to agree on this is the way we measure a child's ability to comprehend and learn. We've got agreement on that test, and now we're using that test to say, where do we put resources to help these kids get caught up? Summer reading programs, reading coaches, reading tutors, just fill in the list. And I anticipate, and I fully intend to work with the legislators that are education experts to say, what can we do best to give each district the tools they need so these kids can get caught up?
One of the things that you were talking about at your State of the State address was also infrastructure spending as one of those crucial things to look into. Well, why is it so important?
Well, it's to me, it's always been important, whether I was in the Senate, whether I chaired the education or the transportation task force for Governor Otter, and in my relatively new job. We know the state of Idaho is growing. We know we've got an interchange right here in town that from a safety standpoint, everybody says needs to be addressed. I have to have two sources of money. I have to have ongoing money for maintenance of both my state highway system and the local, whether it's a county, a highway district, fill in the blank, a city. I have to have money for them, but I also have to have money for my state highway system. But very important, we have to have long-term money so we can do these big projects. An interchange, for example, Highway 20 improvements that, you know, the road that goes out to the lab here is something that we've talked about over and over. Those kind of projects, you need a sustainable long-term source of revenue so that the board, Bob Huff from here in Idaho Falls is your representative on the board, so that they can plan and they can contract. So you can go out and get those really good contractors and say, we're going to do this project in 2021 and 2022 and in 2023. When you have a sustainable source of revenue, you get better bids. The contractors can gear up and buy equipment and train personnel. Those are all important things. We did that during Garvey, but my objection to Garvey was we weren't paying for it. We were borrowing the money, and so right now, about $60 million is going away every year to pay debt service. My proposal is that we increase different kinds of fees, whatever they be, the legislature can decide, so that we can borrow the money, but then we're not going to steal from maintenance money to pay the bonds back.
Okay. Governor, you might be aware that we have been talking in this area of building a big, huge convention center to host hockey, just to bring a lot of, wealth to the area, because we don't really have any major venues to host people like yourself or other people who come here. And so is this plan, this futures investment plan, do you think that would help with some of those types of infrastructure we're looking for around
Well,
here?
we have some funds from the Department of Commerce and from other areas, but auditorium districts, which is what you're talking about, and I know that I've been talking to some of those same people about that, and I know that they thought the cost was higher than they anticipated. So, about 2 years ago, they were ready to pull the trigger on it, and now they're going back and looking at it. But the best way to pay for those things is growth. You have a thriving economy, people are paying taxes, people are booking rooms in hotels. I got to figure out where I am in this in this building. And that's how you pay for those things is that bed tax. But the secret is have a thriving economy, and the real secret is for us to quit wearing these things and people feel comfortable to go to hotels. That's the best thing I can do for a convention is to get that economy back going again, so that stream of revenue comes in to pay for that convention center.
So right now, we're up to about 2% of Idahoans who have received at least one dose of the vaccine. With that, are you still feeling like we're in a place where things can start reopening during the summer?
Yeah, I think so. But I actually just rearranged my schedule an hour ago to dedicate more time every day to try and address the weak links. Is it a hospital? Is it a health district? Is it a provider? Is it the federal government? I just learned today that because some of those rankings where Idaho is, we haven't been getting. I was under the understanding from the vice president that every state was going to get vaccine predicated on their population. For some reason, we're not. My son called me about where we ranked on one of those rankings, and so as I asked my staff about it, it says, well, actually, we're above average in the number of doses we've received and the number of doses that have gone out. But for some reason, we have got less than our per capita share of doses. So I'm just going to spend, and I know it's hard when the legislature's in town and they're all demanding my time for one thing or another, but getting this vaccine out is so important to me. I'm going to dedicate a lot of time to it. What can I do to help a hospital, to help a private entity, to help a health district get this vaccine out? What do I need to do to convince people to take the vaccine? Those are all, and also convince them about how safe it is.
Where is the weak link right now in getting the vaccine out to everybody?
That is a great question. It's different in different parts of the area. I've got some areas where, in essence, they've got every dose that they've got either in the arms or dedicated for somebody that's coming in the next day or the next day. We get our vaccine generally on Monday, which shows this, we got a lot of vaccine, and then we meter it out during the week so that you can make schedule to have people come in, whether they be healthcare workers, whether they be public safety, whether they be teachers, and soon the population that's over 65. So we have to schedule those things so that we don't have a big, and I talked about that yesterday, a bubble or a, you wrote it. But so we have a steady supply so that the healthcare providers, so some areas we're just perfect. The amount of vaccine we've got is going out. Some areas, and I know this is going to be the case, it's going to be pretty financially rewarding in an area where there's lots and lots of people lined up one behind another to get the shot. And then I got rural Idaho where it's going to be harder to do that. And I want to make sure that I'm that my public safety, that my healthcare workers in rural Idaho don't have burdens in front of them, because you can imagine in Ammon or Meridian, Idaho, where everybody lines up and there's a real, you got a big healthcare network there, and Ermac and Mountain View are there delivering the vaccinations. Well, you can imagine what it's like in some of the real rural parts of the state, in Du Bois or fill in the blank, wherever that place might be. So the problem exists differently in different places, but our goal is to get every dose out. And then they changed the rules on us yesterday, unbeknownst to me, and said in 2 weeks they're gonna send us vaccine predicated on how much we get out. And we're building up capacity. But then they changed, the vice president responded to a question of mine about 3 or 4 weeks ago. I said, now do I understand this right, Mr. Vice President, that I'm gonna give the first dose and you're gonna hold the second dose and send it to me 21 days later, because you've got more of these big fancy freezers that are minus 90 degrees Fahrenheit. He says, that's right, Brad. Well, they just changed that yesterday. Now they're gonna send it all to us So we're going to have to do some of the logistics, but we can do that. We will do that.
And is that what that 250 million will help?
It-
Is that where you-
Well, we will find out, to your exact question, where the weak link is every single day and try and put it into the weak link areas. Because, you know, some of these real rural areas, it's pretty hard to motivate somebody qualified to give the shot, somebody to do the paperwork, to go there if they're only going to vaccinate 8 people. And of course the Pfizer comes in I think 975 dose racks. So that, and you got to have a freezer that goes to minus 90 degrees. Well, I can't take that to rural Idaho. I have to take the Moderna vaccine there. We think there's going to be some AstraZeneca and some Johnson & Johnson vaccine, but they keep pushing those back a little bit, which concerns me.
And does any of this pushbacks have anything to do with what's going on in Washington? Are you finding difficulty communicating with them there? Just
Well,
with everything there?
they assured us, there were a lot of governors on the phone yesterday, and the Vice President, Secretary Azar, and Dr. Birx, who was here in Idaho Falls not that long ago, all that they're keeping them informed. I would have felt more comfortable if they'd have been in the room, so that when they talked about this 2-week increase, that they would have nodded their head, because the logistics change if the supply changes. But like I said, I'm just going to dedicate a lot of time to doing whatever we can to make sure if there's a change, we cope with it and continue to get that vaccine out.
In regards to the events that happened in Washington, are you worried or prepping for anything that might happen in the Capitol?
We always prepare for the ordinary circumstances, but the legislative session, I'm inclined to think that the magnitude of what might happen in Idaho will be much less than it is in other states. You know, we haven't erected a fence around our capital like they are in Washington State or Washington D.C. You know, we've been open. People that have an issue with things in Idaho can come into the Capitol, talk to the legislators, talk to me. I think a lot of the frustration out there is much greater in other states than it is in Idaho.
Well, given that during the special legislative session, you did have to remove people from the building or ban at least one person from the state house, what makes you think that might not happen again this year?
It might happen again, but we're prepared for it. We're prepared. The way it works is the state police are in charge, and I appoint the director, the colonel in charge of the state police, but then the legislature controls certain space in the building, and then off of the Capitol grounds, it's the city of Boise and it's in Ada County, but we've aggregated everybody together to have and I think that was part of the problem in Washington D.C. was there was kind of a failure to communicate about, you know, who's in charge. The way I understand the Capitol Police, the head of the Capitol Police is appointed by the Sergeant at Arms of the House and Sergeant at Arms of the Senate, and that communication wasn't as good as it should have been. But we anticipated that, and I continue to talk to legislative leadership, to talk to the city, talk to state police, and I says, is everybody clear about if X happens, we do Y? And they tell me yes, and I have no reason to do anything but believe that they're very well prepared.
You got National Guard on standby or?
Oh, you know, I could. Right now, I got the National Guard intensely involved in coronavirus, but Larry Hogan from Maryland, part of his National Guard, they're trained. They're a security team. Most of my National Guard now, if we need a tank or a helicopter, we're your people. If you need them fixed, we're your people. But we don't have a big law enforcement component of our National Guard. We got very dedicated, incredibly capable people. But our National Guard is not like some states where they're a big component of military police. So it's a little, if we need them, they'll be there to help. But I don't anticipate we will. So. Right now, they're trying to help with health districts, with vaccine distribution, with testing, with all those other issues. And the National Guard, my ability to pay for them is under that emergency declaration. If I don't have the emergency declaration, we got to write a check out of the general fund to fund them. So.
For people that may have received stimulus checks due to the, want to get them during the pandemic, will they be affected in any way this tax season?
Well, the direct check is not taxable. So the direct check is not taxable, but all the unemployment benefits are. And I didn't but the PPP money is. The only thing that's not taxable is the direct check, and Congress specifically said it's not.
Check that Congress has sent.
Yeah, both the first one and the second one. So.
What are some of the employment benefits that were sort of talked about earlier this year? Well,
Of course, there was the $600 a month, and I can't remember all the acronyms. There's PUA and PEUA, and but the $600 one was the big one, and that ended in July. And of course, I put together in Idaho, the only state, we put in an incentive for people to go back to work, because if somebody was saying, I'm getting $600 a month extra, and the employer said, why don't you stay home, Brad, and collect that $600, and I'll call you back to work afterwards. We put incentive out there to try and get people back to work, and that's why our unemployment rate was one of the best in the country, because we put that program there. Mainly what they did is extend all the other benefits, not only traditional unemployment, but the PUA, which are people that don't pay, gig workers, private contractors, people that don't pay into unemployment. They basically, there's a new program for them, and they extended that. Both of those will help, but I'm always, we need to help some of these folks, but I also don't want to create an incentive for people not to go back to work. And that's always an issue.
So once we get past COVID, what do you hope to get done?
Well, what I hope to do this summer was spend more time focusing on economic prosperity and education. I've been derailed a little bit. They're still my highest priorities, but I can't advance education. I can't advance economic prosperity if people are scared, if people are worried about their health, if people aren't going to restaurants, if people aren't investing, if employees either can't show up or they're home with their kids. So that's why it's so important for us to get through COVID, to restore that economic momentum that Idaho has, because as I stated in the State of the State, which I understand you even listened to, that we were number one for economic trajectory for a good reason. And this community is a good example about what's taken place here, but it's really replicated all over the state of Idaho. The growth has taken place, existing businesses and new businesses, and businesses that are just increasing their bottom line through creativity and hard work. We all done, Marissa?
Have fun then. They
I
got
do
it.
have one more
Okay.
question.
Oh, go ahead.
Go ahead.
Well, why isn't testing free and absolutely everywhere, and anybody can go get it on a twice a month kind of thing? Why?
It is free, and it's not uniform everywhere. For the most part, it is free. Either insurance picks it up or the government picks it up. One of the issues is testing does not resolve everything. I got tested Monday. There was a program that Boise State and IACI did, and we took saliva tests. I've had everything. I've had the PCR test, the Abbott test, but all the testing says is at a certain stage in the disease, I show either the antigens or they can replicate the disease. But that doesn't mean that I wasn't exposed to it a day before and the level wasn't high enough. So you can't test your way out of this, but it's helpful, and we need to continue to do more testing. But right now, if I get somebody vaccinated, I can quit worrying about testing them instead of, as you said, and I have been predicting all along that there'll probably be a $2 at-home immediate test about the time we get done with the disease. But the next time we have a pandemic, it'll be helpful. But we've come a long way from that very invasive PCR test and labs that we had to wait sometimes 2 and 3 weeks to get the results, which wasn't doing any good. Now we've got a lot more lab capacity. We're getting a lot more tests, and we need to continue. There's certain people that absolutely have to be tested. Workers in long-term care, workers in healthcare. We have enough capacity right now. Our testing, there's a dashboard that's sent out by the White House. We're in the green zone. We're not testing as much as some states, but we're testing, on a practical basis about, and I don't know what, I remember Juan Alvarez asked a question when Dr. Birx was here about the lab, but I think the lab's got plenty of testing for their critical employees right now.
Idaho Ed News posted an article not too long ago that teachers and school staff are finally eligible to receive the COVID-19 vaccine. I was wondering, what was the decision in making that happen?
Well, I actually made that decision yesterday. I made the announcement yesterday, but my North Star has been healthcare capacity. I've got to take care of healthcare capacity, and people that are older and immune compromised are part of that, because if they don't get COVID, then they don't plug up my hospitals. But having kids in school is so important to the economy, and it's frankly important to healthcare. The nurses at ERMAC up here and the doctors, if their kids are home and they're having to help their kids because they're not in school, that hurts my healthcare capacity. That was one of the reasons. Besides that, those teachers have been making big sacrifices, and we owe it to them. Now that I got my frontline healthcare workers and the people in long-term care facilities taken care of, to do them so they can continue to be in the classroom and teach our children, and also help with the economy, because if schools are going, people aren't worried about having to be home because their kids are in and out, and that uncertainty, that's the reason that we put them on that area in the list. And that's one that, on a state-by-state basis, some states, they're quite a bit down the list. The recommendation from CDC, they were down the list. We elevated them up as we did the 75 to 65-year-olds.
Does that say something about the progression in the state of Idaho as far as vaccines go? Would you say it's going in the right direction?
Well, it is, and of course, every day we're building capacity. When I met with my healthcare team this morning, when we made the announcement yesterday, they said their phone rang off the hook about, well, we weren't going to do vaccine, but we are now, that there's going to be more of it, and we're trying to do everything we can to incentivize it. There is a lot of healthcare capacity. I talked to my doctor last night in Emmett, because Emmett's doing kind of something unique. The Emmett Hospital is with the Boise hospitals, and he said they're getting ready to have a max vaccination facility at the old sawmill. And I was very, and that's that's kind of the creative American Idaho mind, to say, let's figure out some way to fix this thing. And we just want to unleash all that creativity to get everybody vaccinated. And that's why I've dedicated some of my time is, if I got barriers, legal barriers, public barriers, federal barriers, what can I do to get them out of the way so we can get everybody vaccinated?
What would you say to teachers or healthcare workers or who's eligible to get the vaccine now but doesn't want to get it, who still has some concerns about whether it's worth getting vaccinated at the moment?
Whether the vaccine's effective?
Or just whatever.
Safety?
I've heard a lot of different
Well,
concerns.
and I was probably a little bit of an outlier, because some of the governors and some of the people, the minute the vaccine was available, they wanted to do a big public safety campaign. And I said, well, let's wait and see what it's out. We know what the research was from Merck and Moderna, but the best way to feel comfortable about getting a vaccination is if your friend or your mother or your doctor gets the vaccine, somebody you know that's a nurse, and they said, you know, my arm was sore for a little bit. I might have had a little bit of a headache, but now I've got way more comfort level about my risk of COVID, and I feel a lot better. That's the best way to convince people about the safety of it, is for them to know a broad swath of people that have been exposed, that have had the vaccine, and that they didn't have any negative consequences. And you know, if they're in a group and most of the group say, we got vaccinated, we're great, and there's still a question about that. And on the call with the vice president, we talked about it, about, so how long after I get the vaccination before I can quit wearing these darn things? And what we don't know is the person will be protected, but can they pick up the virus and spread it to somebody else? But I think it was Dr. Redfield, who's head of CDC, said that research is ongoing. We will know pretty soon how long we'll have to continue with some of these other protocols after you get a vaccination. And so that's why I've been not making great, I've got more people want to get vaccinated than I got vaccine ready to go. As we get closer and I need to get those hesitant people vaccinated, we'll do significant public outreach with our healthcare and public health partners.
Is there anything in Boise that you're looking forward to during the legislative session right now?
We've got a lot of initiatives that are on my Building Idaho's Future. I look to have a discussion about those. For the most part, the reaction we got from the legislators was quite favorable. The conservative legislators liked that it was one of the most conservative budgets, perhaps the most conservative budget outside of a recession year in the last 20 or 30 years. That it was only 3.7% increase. The fact that there was significant tax relief in it, the fact that we were investing money in education and infrastructure. Obviously, there's always somebody that's going to have an issue with it on one side or the other. But I spent a lot of time around Idaho, and I think that's what most Idahoans want. They're going to get to pick on it a little bit, and that's their right. That's their constitutional to scrutinize it and to have the debate about it. And I'll be more than willing to engage with them. But we feel pretty comfortable about our budget proposal and our statutory proposals. We don't have anything here that should keep the legislature for an abnormal length of time, other than there's a big budget surplus and they decide they want to start picking away and spending it and doing some other things that might, sometimes having a big surplus is harder to allocate than having just the right amount of money or even a little short. Anybody that's been around the legislative budgetary process will tell you that. Senator Baer, that's the chairman of the Finance Committee from up here at Blackfoot, will tell you that having extra money, that good idea that we had 3 years ago, let's bring that back and pay for it. But that's the way the system is.